All right, everybody, get ready because today we are taking a deep dive into a topic that's, well, let's be honest, way more common than we might think, and honestly, a lot more interesting than it gets credit for. UTIs.
Yeah, urinary tract infections. And you've provided us with quite a bit of research on this, so clearly somebody is ready to become an expert.
Seriously, we are talking a stack of papers here, a recent review, even from Nature Review's microbiology, so somebody means business, that's for sure.
And we are here for it.
Absolutely. So are you prepping for something big, maybe a grand rounds presentation, or doing battle with a UTI yourself?
Whatever it is, we are here to break it all down, not just the basics either, but like the latest research on what's going on, why they can be so persistent, the works, and what researchers are looking into for treatment and prevention.
I love it. Okay, so for those who need a quick refresher, UTIs, we aren't just talking about the bladder when we say that,
All
right?
right, think of it more as any infection anywhere along the urinary tract. So that could be your urethra, your bladder, could even be your kidneys, and that is not fun.
Yeah, no kidding. Speaking of no fun, the global scale of UTIs always kind of blows my mind. Like, the Nature Review mentioned something like 400 million cases every year. That's globally, so it really is a big deal.
It's a huge global health challenge for sure, and those numbers, I mean, we're talking billions of dollars in healthcare costs, not to mention the human cost, all the discomfort and suffering. Yeah, definitely not something to be taken lightly.
Not at all. Okay, so we've got these UTIs. Most of the time, it's bacteria causing them, primarily our old friend E. coli. Is that right?
Right, E. coli is a common resident in our gut, doesn't always cause problems. Some strains are actually good for us, but there's this specific type, uropathogenic E. coli or UPEC.
Yeah.
They're usually the main culprit behind UTIs.
UPAC. Got it. So is it as simple as saying if you've got E. coli in your system, you're doomed to get a UTI?
Well, not quite. It's more complicated than that. Even within UPEC, there's no single gene or anything that makes it a guaranteed UTI trigger.
Oh, really? I would have thought by now they would have found some sort of smoking gun.
It's just way more complex than that. It's not just about it being there, but also how well it causes disease, how virulent it is.
So it's not just about the bacteria itself, but what kind of, like, fighter power it's packing.
Exactly. But remember, our bodies aren't just sitting ducks in all of this. Our own health, genetics, even our own microbiomes, those all play a role in whether or not that run-in with UPEC actually turns into a UTI.
Okay, so it's like this whole microbial game of chess. Both UPEC and our bodies have their own set of moves.
Exactly. It's this constant interplay. And figuring out that dance between the bacteria and our immune systems, well, that's what determines the outcome.
Okay, so we're talking about this kind of microbial dance-off happening, but let's be real, getting a UTI doesn't exactly feel like a party, so what is actually happening in our bodies when those UPEC bacteria decide to make their move?
So picture this. You've got these UPEC bacteria, right? And they're armed with these tiny little grappling hooks. They come up to the bladder wall, ready to cause some trouble.
Okay, grappling hooks, those are the pili we've heard about, right?
Exactly. Those pilies, they're like bacterial superpowers. They help them latch on.
So they make their grand entrance, latch on with their grappling hooks. Then what? They're not just content with hanging out on the surface, are they?
Oh no, this is where they get really sneaky. They use those pillars to attach. But then they take it a step further. They actually get inside our cells.
Inside, like breaking in.
Exactly. They trick our cells into letting them in. And then once they're inside, they can form these little hidden communities, almost like, I don't know, underground bunkers or something.
And the Nature Review called these, what were they, IBCs?
Yeah, intracellular bacterial communities. It's a mouthful, I know.
IBCs, I've got it. But why go through all that trouble to get inside our cells? Like, what's the advantage for the bacteria?
Protection, basically. Inside your cells, they're shielded from your immune system. Even some antibiotics, like they found the perfect hiding spot.
Oh, talk about a double whammy. Not only are they hard to reach in there, but they're also using our own cells against us, so they hunker down in their IBCs, wait for the coast to clear, and then what?
They can lay low, multiply, maybe even launch a bigger attack later on.
Wow, these bacteria, they're strategic, I'll give them that. But hold on, our bodies aren't just going to roll over for this. We have defenses, right?
Absolutely. Your body is way more prepared than you might think. Even your bladder lining, it's coated with these proteins to make it slippery for bacteria.
Okay, our cells coming prepared with the nonstick surfaces. I like it. What else we got?
Well, your body also produces this protein. It's called Pam horsefall, another mouthful I know, but this protein, it's like a bacterial bouncer.
A bouncer. Now I'm really intrigued. Tell me more.
It basically binds to those bacterial grappling hooks, those pili, and keeps them from attaching to the bladder wall.
No entry for you, UPEC. That is seriously cool. I'm picturing this Tam horsefall protein just like a shield, batting away those invaders left and right. But what happens if some of those bacteria do manage to get through all of our defenses? What then?
Then it's like the alarm bells go off and your immune system jumps into action, sends out the troops.
Time for backup. So what does that look like?
Well, the nature V2 talked about how UTIs cause inflammation, right? And that's basically your body sending up an SOS, calling all the immune cells to the scene of the crime.
So inflammation, that's actually a good thing in this case.
Yeah, it's your body fighting back. It's sending those immune cells, those neutrophils, to engulf and destroy those bacteria.
So in a way, inflammation is a sign our bodies are doing their job, like they're fighting off the infection.
Right. It's totally natural and essential for healing, but, and this is important, too much of anything can be a problem.
Too much inflammation, that doesn't sound good.
It's true. If you have too much inflammation in the bladder, it can actually backfire, even damage the lining, and that just makes it easier for bacteria to invade later.
Oh, so it's like a double-edged sword then. It helps in the short term, but it could make us more vulnerable in the long run.
That's the thing, and it's possible that's what's behind this issue that so many people struggle with, those recurrent UTIs.
Recurrent UTIs. Ugh, the worst. I know so many people who struggle with those, especially women. It's like, what makes them so hard to get rid of for good?
Yeah, it's a tough one. Researchers are really trying to figure that out, and Nature Review, it really digs into this. And get this, it might not even be a new infection every time.
Wait, really? So it's like the same UPEC bacteria just making a comeback, hanging out somewhere, waiting to strike again.
You're on the right track. Remember those IBCs we talked about, those intracellular bacterial communities hiding out inside our cell?
Yeah, sneaky little things.
Well, some of them, they can actually go into like stealth mode. They call them quiescent intracellular reservoirs.
Quiescent, meaning they're just like dormant, biding their time.
Exactly. They basically go to sleep almost like bears hibernating, waiting for the right moment to wake up and cause trouble again.
Okay, that is both really cool and also kind of terrifying, but I guess it explains why just taking antibiotics sometimes doesn't actually solve the problem long term.
Exactly. They can be resistant to some antibiotics, and then they reactivate once the coast is clear. It's a real challenge, which is why finding new treatment and prevention strategies is so important.
Speaking of which, the Nature Review brought up our gut microbiome, and I know that's a hot topic these days. Everybody's talking about gut health.
And it's not just hype. It really does play a way bigger role than we used to think, even when it comes to UTIs.
Okay, so it's not just about the UPEC and the urinary tract, but also what's going on in our gut. But how are those two even connected?
Well, for a long time, scientists thought of the gut mostly as a source of UPEC, like a reservoir waiting to travel to the bladder. But the Nature Review, it suggests it's way more complex than that.
More complex, how?
Well, the diversity of your gut microbiome, like how many different types of bacteria are living there, that seems to really matter. Having a healthy, diverse microbiome could actually make you less likely to get those recurring UTIs.
Interesting. So it's less about any one type of bacteria being there and more about the overall balance, like a healthy ecosystem.
Exactly. Think of it like a garden, right? A diverse garden is going to be more resilient, better able to deal with any pests or diseases. And there was another interesting tidbit. The review specifically mentioned these butyrate-producing bacteria.
Butyrate-producing, that's a new one. What's so special about them?
Well, they produce this short-chain fatty acid butyrate, and it seems like it might have protective effects against UTIs.
So more butyrate-producing bacteria in our gut, good for keeping those UTIs away.
It's still early. More research is needed for sure, but it's a really promising area of study. It shows you how important it is to look at the big picture, the whole ecosystem, not just focus on one villain like UPEC.
See, this is why I love these deep dives. It's amazing what you learn when you really get into it. But okay, enough about the problem. Let's talk solutions. What does all of this mean for actually treating UTIs, especially those recurring ones?
$1 million question, right? Well, the good news is researchers are making progress. The Nature Review actually highlighted some promising new approaches that go beyond your typical antibiotics.
Okay, I'm listening. What's in the works?
For one, they're working on new antibiotics, ones that the bacteria haven't developed resistance to yet. Two promising ones mentioned were gepotidacin, and then this other one, tebipenem pivoxyl hydrobromide. It's a mouthful.
New antibiotics, that's definitely good news, but it sounds like the goal is to reduce our reliance on them overall, right?
Exactly, because overusing antibiotics, That just leads to more resistance, so scientists are looking at other options too, like these things called anti-adhesives.
Anti-adhesives, what are those? Do they have something to do with those bacterial grappling hooks?
Ding, 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 you got it. Remember how those pili help bacteria attach to the bladder wall? Well, anti-adhesives, they block those grappling hooks, make it harder for the bacteria to latch on in the first place.
So it's like disarming them before they even start a fight?
Exactly, and the review talked about these things called manicides. They're a type of anti-adhesive, and they've shown some really good results. One is even in clinical trials now.
Wow, so we're getting closer to having new weapons in our arsenal.
We are, and there's even more. The review also mentioned vaccines.
Wait, a vaccine specifically for
Yep,
UTIs?
it would be a game changer. And there's one called XPEC-9V that's in phase 3 trials right now. It targets those most common E. coli strains that cause UTIs, and the early results look promising.
Wow, this is all amazing news. It sounds like the future of UTI treatment and prevention is looking brighter already.
I think so. It's definitely an exciting time to be following all this research. Who knows what other breakthroughs are just around the corner.
I know, it's really incredible. Well, that was quite a deep dive into the world of UTIs. I don't know about you, but I feel like we covered a lot of ground.
We did. It's amazing what you can learn when you really take the time to dig into the science.
It really is. And you know what? I'm actually leaving with one final thought. The Nature review, it barely even scratched the surface when it came to the urinary microbiome itself. We talked about the gut, but what about the microorganisms that are actually living in our urinary tracts? Could that be the next big thing in understanding and treating UTIs?
Hmm. Now that is a question and a good one to think about. It
But
seems like there's always more to learn, always more to explore.
that's what makes it all so fascinating, right? Well, until next time, keep those brains curious, everyone, and never underestimate the power of a good deep dive.